Welcome to the Pre to Post Transplant Podcast, a podcast that brings personal stories from transplant survivors, their families, friends, and loved ones. This is where you will hear challenges and triumphs of everyone involved in this journey. Our guests will offer wisdom, advice, and inspiration on everything you want to know about transplant. My name is Jenny McFarland. I am a transplant survivor, and this is a podcast I wish I had before and immediately following my transplant. Thank you for listening. Hey everybody, this is Jenny McFarland, your host of the Pre to Post Transplant Podcast, where you get to tell your side of the story. Today's episode is exciting, of course. It's inspirational, and I'm excited for this episode because I got to talk to Amy, who is just a baby. And we talk a little bit about this in the podcast, but I say she's just a baby because she is so new to her transplant. I'm going to let you listen to what she has to say about that. I'm not going to waste too much time on my intro. I just want to remind you guys to please leave a rating and review. I don't have enough of those and I want more. And so if you could just please go onto your Apple platform and leave a review and a rating. Hopefully 5-star, but be honest. Tell me what you think. And of course, go onto the website to see all of the episodes, see everybody's picture. Next to their episode, I have most pictures of everybody. And, you can hear episodes by organ or category or medical condition. And I have some update episodes that I've done with people. And there's another update episode coming up pretty soon I'm excited for. So stay tuned for that. And, of course, reach out to me if you want to be on the show. I need more guests. I want to get out the episodes, sooner than I do. So I just need more people. So I'm just going to jump right in. That way Amy can share her story. So help me welcome my guest, Amy Hopfensperger. Hi, Amy. Thanks for being on the show today.
Thank you.
So first, I want to ask you when you had your transplant, where you had your transplant, and why you needed one.
I had my transplant in January of 2023. It was a liver transplant, and it was due to what they know now as cryptogenic liver failure, so unknown causes. And I had it at University of Wisconsin-Madison.
Oh, okay. So January of 2023. Wow, you're just brand new. You're only 6 months.
I am.
That's awesome. Yep. That's awesome. Okay, yep. So tell me about your liver. What was going on? Like why all of a sudden did they decide to give you a transplant?
So just actually a year ago, this past May, I was at work. I actually worked in the healthcare field and was taking care of, at the time, COVID patients. And I was going up the stairwell and my Apple Watch actually told me that my heart rate was 167. And I almost fainted in the stairwell. And that was the first time that had happened. You think back, did you eat something that morning? Did you drink water? And of course, I had done none of the good things because that's what we do when we take care of patients in the hospitals. We don't take care of ourselves. So I thought nothing of it, went and took care of the patient. And then I ended up, going to get something to eat. And I just didn't feel right all day. So I made an appointment with my primary care. The next morning, I ended up going in for blood work and was severely anemic with a hemoglobin in the 5 range, which I had never taken a pill in my life, had an issue, anything. At that time, all the other lab work was bad or was good, except for I was iron deficient out of nowhere. I had never been iron deficient in my life. Mm-hmm. So they gave me some IV iron, gave me some blood transfusions, and kind of sent me on my way saying, you have to take oral iron now for the rest of your life. And then about a week later, I developed really bad abdominal swelling where my scrub pants couldn't even fit without loosening them all the way up, where I used to have to tie them because they were too loose. And then I had leg swelling about a week after that. And so I found a different primary care that would listen to me because you have to advocate for yourself.
Right.
And she listened to me and got me in with a specialist. And then they told me it was my liver, even though my liver panel was near normal at the time. So I had a liver biopsy, and in 10 days, my liver went from being normal to acute liver failure. And I had to go on the transplant list. And then I actually had to go on 2 transplant lists because of how young I was. They thought I wouldn't make it if I was only on 1. So this all happened literally 12, 13 months ago.
I didn't even know that there was 2. How, you mean like two different centers, like two different
Yes.
cities? Oh, okay.
Yeah, I
Yeah.
had to get dual listed at two different places in
Oh,
the
I
state, but
see.
I had to be within a certain amount of there were I think it was like 4 hours maybe I had to be
Right.
within the transplant center. And so from where I lived, even if I moved, I couldn't get enough, like more than two. Because of Wisconsin, up where I live in the Northeast area, there's none. They're all down Madison and Milwaukee. So I actually
Yeah.
got listed in Milwaukee first and then ended up going to Madison after because Milwaukee could get me in first. So that's the only reason I went there first and then went to Madison and got listed after that.
Yeah. Wow. Okay, so um we kind of jumped ahead a little bit. So back when you were going to the doctor, you said your first primary care doctor didn't really do much. How did they
Mm-hmm.
know that it was your liver if all of your liver blood work was normal? Was it just because of the swelling?
So again, I worked in healthcare. I was a nurse practitioner. So
Oh,
I
you
told
kind of
them that
knew.
I felt like, yeah, well, I kind of knew, but I kind of didn't. Like I felt like I had fluid in my abdomen, but I had no idea why I would have fluid in my abdomen. And they
Hmm.
had done some x-rays, which doesn't look for fluid, but they were looking for other things and they couldn't find anything. And even on her physical exam, she said, I don't feel any fluid. And I said, I just feel like I have fluid. And again, it's an advocating part because nobody wants to listen to you. They think you're just a complainer or something.
Right.
And so she finally listened to me after the third time, and she had worked with me in the hospital about 15 years ago. So she knew I wasn't one of those people, thankfully. But so
Yeah.
she ordered a CAT scan. And so I was actually at work drinking my contrast as I went for the CAT scan because, I'm still working at this time. And they did the CAT scan and found a huge amount of fluid and a severely enlarged spleen. And so at that time, they didn't know it was the liver. They just kind of put the pieces together and assumed maybe that was causing those issues, but they weren't sure. So actually, I went to infectious disease next because they thought my spleen was due to maybe a viral illness of some sort and thought maybe that was causing all this, but it wasn't. It was ruled out. But they drew fluid out of my abdomen after that, and nothing came back. And then within a couple of weeks, my liver enzymes started increasing.
Yeah. So how did that work? Like you said you were going to work, but at some point you probably got to the point where you couldn't go back to work, or were you like feeling
Well,
okay or
again, no, I wasn't. And again, we make really bad patients. I'll be the first to admit it as healthcare people. And so I went to work every day and it was very, very difficult. I can't say as I compromised healthcare of any patients by any means, but it definitely probably compromised my own health. I
yeah,
just didn't at that time know that it was bad. And I'm one of those people that I don't want to sit at home not feeling well and feeling bad for myself because I try and look for the positive. So it's easier for me to go to work and deflect, basically. That's just my own, again, not really good maybe for you, but that's my coping. So
yeah,
I ended up in the middle of May. I went for a biopsy through the neck where they went through the heart and down to the liver and took out 7 core samples of my liver and said you were in, end stage liver disease. And by that time, I was needing blood transfusions at least once a week. And then I was needing fluid drained out at least once a week out of my abdomen. So at that time, when I applied for intermittent FMLA at work, meaning if I had a procedure, I could just
yeah.
get off. The doctor said no, like they weren't willing to fill it out unless I would be off completely
Oh,
because they didn't think I should be there. And I kind of needed to hear that. So then
yeah,
obviously I didn't say no to that. I didn't necessarily like that answer, but it probably was for the best of me. But I
yeah,
didn't do that on my own. Somebody had to tell me, basically.
yeah, yeah. Well, I can understand, And then
Yeah.
so this all kind of happened like super fast. So I know that being a nurse practitioner, you probably already knew at least a little bit about organ donation and stuff like that. But um, so you you knew what it was, right? So how did you feel knowing that now all of a sudden like this happened so fast, you're doing fine, months ago, now you need a liver transplant. How did that like affect you emotionally?
Yeah, it was really tough. Honestly, I work at a two different hospitals in the system, and one of them is a level 2 trauma center where we do quite a bit with UNOS with the donations.
Yeah,
And we actually work with the OPO through the UW system where I got my transplant is where we also give our donations. So I mean, I was familiar with the donor side because I cared for patients, a lot of trauma patients, stuff like that. Super sad, obviously. So it's not only hard to think that somebody has to die for you, but when you've been through and you've seen the patients die, like I've been a part of those donor walks myself over probably 500 times in the last 20 years. So to know that you were waiting for one of those to happen for you is like such a surreal feeling. Like it's a good thing, but it's a bad thing. And then honestly, my personal problem was telling my mother. Like I had a really hard time, like I kind of made light of it, like, oh, this doctor, this specialist might bring this word up, but you never know. It's kind of like we call the big C word with cancer. I felt
Yeah.
like I don't know how to tell my mom, because I'm younger, and I didn't, this came out of nowhere. And this was right after the COVID era of when I was super stressed at work and not really doing anything with family or friends because I was exhausted all the time. So
Yeah.
they already felt like they were kind of like not seeing me and doing things. And then I had to tell my mom, oh, by the way, this might happen. And then they told me you're going to die without a transplant by the end of the year. And they told me that in the end of June last year at the transplant center. So like, I didn't expect her to, I thought she was going to be the next patient on the ground when she got told that. So that was my hardest part, was telling my mom, honestly.
Yeah. And so whenever you did finally tell her, how'd it go? How did she take it?
I think she tried to put on a really good face. I know like inside she was struggling, but I think she tried to be strong, like any of us would do for any of, children or parents, and I did the same thing. I coped the same way where I was like, we'll get through this. It's okay, and inside I'm like, of course, scared out of my mind because I don't deal with organ donation other than the side of the trauma patients or whatever that give the organs. I never actually, took care of organ donation patients other than recipients that had their organs years and years and years ago and were in our hospital for some other reason. But otherwise, I had no direct care to transplant recipient patients. So it was a little different in that regard. But I kept trying to tell her like it was okay, whatever. But then as I got sicker, it got harder for me to talk to her about that kind of stuff.
Yeah. Yeah. And so you stopped working and you were home. And how did it go up leading up until, you got the call? Like first, how long were you officially on the transplant lists? Both of them.
Yeah, so I went to Freighter Medical Center in Milwaukee, Wisconsin in June for my first consult.
Okay.
Went through all the classes and all the testing and got on their list in the beginning of August. And that was when I actually got hospitalized for the first time. And I was hospitalized for about 11 days, got really, really sick, had a lot of complications from liver failure. That's really when I felt like it was real. Because before that, I wanted to be like, it's not really that bad. It's going to get better.
Yeah.
But that's when I actually felt as sick as they all told me I was, because I think I was younger. I was just kind of coping differently. Then at the end of August, I went to made an appointment with UW and got lifted there in beginning of October.
Wow. That happened really fast. Like,
I got really sick around Thanksgiving and Christmas. Yeah, I almost died by New Year's. So I was very, very sick. Because with liver failure, it's a little different than some other organs. Some of the organs, it's like timing on a list, it's timing with this. With liver failure, you actually have to get sicker, like really, really sick, for your MELD score to go higher to qualify for the liver. So if I would have gotten one back in June of last year, I would have flown through that surgery and done so much better. But by the time it got to be December, I was really, really bad, like really bad. I had to see palliative care last summer to talk about whether I wanted hospice or a transplant, because they're like, you're going to die without a transplant. And so like, again, working in the medical field, I know what hospice and palliative care is. That gets a little scary as well, because I know too much about that, but I understand why, but that's kind of scary too.
so do you think that you're kind of grateful that you already kind of knew about it since you're a nurse or a nurse practitioner?
Um,
Or do you think it
with the
would be
palliative
better?
care part, you mean?
No, with the whole thing. The
Oh, the
whole,
whole thing.
yeah.
Um, 50-50. I would say for like procedures, it was easier because, they explain it, but they don't explain it very well. Let's be honest. They don't really, and as patients, they don't really tell you because they've never been through it themselves. It's
Yeah.
totally different when you go through it and you can explain it. So
Yeah.
I knew from going through it and then seeing patients go through it and talk to the patients, that part. So for procedure part, yes. For complications and everything, I would say no. It was actually probably a hindrance because I couldn't shut my brain off, because I was constantly thinking like, when's this going to happen again? When's this? And then every time I had one little problem with my breathing or one little, abdominal pain, or, I thought I, coughed up some blood or anything like that, I was thinking the worst of it, and stuff like
Yeah.
that. The one thing post transplant that it really helped with is medications.
Oh,
Hands
yeah.
down, the medications that's helped me immensely more than anything. But I would say it's about a 50-50 prior to transplant.
Yeah. So I'm not in the medical field, but I kind of feel the same way. So before I started this podcast, I was just your regular, I've been in the hospital in and out my whole life, so I kind of knew some stuff, but I didn't really know I didn't know anything about transplant other than what I learned, in one day at my evaluation. And so I thought, doing this podcast would be great to provide information to people so they can hear other stories. And I still think that's great, but I've heard so many different things about different things. I've heard so many positive things and so many like not so positive things and struggles that people have gone through that I feel like if I would have known that stuff before my transplant, I would have been a little bit more scared about the outcome. So I'm kind of like mixed feelings there because I feel like it's good to have the information, it's good to hear stories, but those things can also lead to like other fears and other worries of complications that you could potentially have that other people have gotten. So I'm kind of like bittersweet on the whole thing.
I think when I talk to like podcasts, when I listen to podcasts or go to like those online support groups and stuff, a lot of that is more practical too, that not a doctor's not necessarily going to tell you. Like,
Yeah.
when I had liver failure, here were the side effects of this, or here's the symptoms of this, or a side effect of a medication. A lot of the practical, like quality of life quite type of side effects, those are not discussed by hospital staff. It's more of the people that actually go through it that
Yeah.
tell you, like, hey, you're going to lose more than half of your hair, or you're going to do like all that kind of stuff. I feel like is one of those things that you're not going to hear from a doctor or whatever, but you'll hear it from the group of support people that have gone through what you've gone through.
Yeah, for sure. For sure. So, okay. My other question that I don't think I asked was you're at home and you're not working. How are you feeling? Oh, you did talk about that. You were in the hospital in October, you said?
August. I
August.
started in August. Yeah.
So how was the rest of the time after that, leading up to your actual transplant?
So I was actually in the hospital August, September, October, November, December, and January, and was actually in the hospital when I got the phone call for the offer of the liver, because I basically spent 4.5 months in the hospital, and I think I was home 14 days out of 4.5 months. So I basically was not home like at all. I spent Thanksgiving, Christmas, New Year's, all of those holidays, all Halloween. I spent them all in the hospitals. So I wasn't home.
Yeah, and that whole time you were just waiting for that call.
Yeah, again, because I'm younger, I was told like my MELD score was not going to change very much, even though I had more complications than half of the liver failure patients. But those complications don't add to that number. There's only like 5 things they look at for that MELD number. So if your MELD number doesn't go up, it doesn't matter how many other complications you have. So they basically just kind of put band-aids on the problems until it gets bad enough for your MELD score to go up. And it was bad enough definitely to get listed, but not, I was like tier, I think, 2 when I got listed, and then there's 3 and 4. And so by the time Christmas came around, I was on tier 3, and then I was on tier 4 by the week after Christmas. And so after that, after Christmas, they called me from both centers and said, you better be ready because your number has gone up and it's been consistently going up. And then I was scheduled for dialysis actually the next day after they called me with the offer. So I was kind of expecting it then because I was on my 17th day in the hospital at the
Yeah.
time I got the call.
Yeah.
Yeah.
And so what did that well, let me ask you this. Like, were you worried that you weren't gonna get the call in time, or did you pretty much know it's gonna happen any second? I'm gonna make it. I'm gonna make it through it.
No, I'm pretty realistic. I did not assume I was going to get the call at all. And honestly, I was kind of more sad thinking it was the holidays and that somebody was going to lose a loved one, at Christmas and New Year,
Oh,
like at the holidays, and that I would have to hope for somebody to pass away at the holidays and their family would have to deal with that with me living. Like that time frame just was not good for me mentally because I didn't like how can you pray for somebody to pass away like that? it was a struggle, a little bit of a struggle for me. But no, I didn't know. And I had talked to, palliative care a couple of times, and I had redone all of my living wills, and I had went to, the credit union and done all of my, if I die, here's what I want with my estate. And I had done all of that stuff ahead of time because I was told, like, if you don't get a liver by the end of the year, you're going to die. And we were buying time, and I got the call on January 4th. I mean, so it was, I mean, I don't know how she knew that in June, but she knew that. And so as it got closer to that and I got sicker, I mean, I was getting worried that it was time, that I wasn't
Yeah.
going to get it. So it came honestly as a shock to me. I had no idea I was going to get the call.
Yeah. And so what was it like when you finally did get the call? Because you were already in the hospital, so you didn't have to like rush over there.
Hmm. I did only because they wanted to. I was 2.5 hours away, and they wanted to optimize me because I needed dialysis. Because even though I was there
Oh,
for liver failure, my kidneys had taken a huge hit. And I had gone into issues with my brain back then because I had toxins from, well, I already had toxins from the liver built up in my bloodstream, but then I had toxins from the kidney disease too. And so I don't even remember, like, 8 days prior to the call, like, people came to visit me at the hospital. I don't even remember it. Don't
okay.
remember talking to them, nothing. But I do remember getting the call at 8 o'clock at night because I remember we were supposed to get a snowstorm, and I was very fortunate that it only sleeted and it was good. So we went down there. I had to be there by midnight to meet the team and go through all the, urgent testing and stuff like that. And then a friend of mine and my mom went down too.
Okay. I guess I misunderstood you earlier. I thought you were in the hospital when you got the call. I didn't realize
I
that you were
was.
home. Oh,
No, I was at the hospital. I was at
I'm
a local
confused.
hospital here. Yes. I wasn't at
Oh,
the
but you're not at the
transplant
transplant
hospital.
center. Okay, that makes
They
sense
didn't,
now.
yeah, they didn't have a bed. They didn't have a bed for me. So I had to go to a local hospital
I
because
see.
they didn't have any beds at the other place.
Okay, that makes more sense now.
Yeah,
Okay, so you made it, and thank God it didn't
I
snow
did.
hard. And
Yes. Yep.
so, how did it go? How did the surgery go?
I guess the surgery went really well. I don't remember a lot from that time, but it was about 9 hours or so, 9.5 hours. And I guess they told my mom that the liver fit like a glove and that it just, like, kind of took to right away.
Oh, good.
I was in ICU for a couple of days. I had issues getting the breathing tube out because of the bite block in there that was holding it in, migrated to the back of my throat, and they didn't know that. And so they kept saying that I couldn't get it out because my airway wasn't open, but it was because there was a foreign body in the back of it. But I finally got that out and everything. And I needed obviously a lot of blood products and stuff like that. But all in all, I think it went pretty good. I was only on oxygen after the breathing tube got taken out for about, I think, 12 hours or so. Then I
Okay.
got sent up to the transplant unit. I did really, really well for the first week. And they were talking about sending me home after about 7 days because I was doing so good. But then my liver numbers started going up. And so after about, I would say, 10 days after surgery, I had to go for a liver biopsy. And they confirmed that I was going through acute rejection already. And so they said with my age group, that's not uncommon. So then I had to get loaded with, IV steroids, and then they wouldn't go down. So I needed like 5 days of that. But then eventually I got to go home and stuff like that.
Yeah, that is common. I had that once too. And
Mm.
I think it's just within your first year, I think it's pretty common for a lot of people to get acute rejection. But it's terrifying when they tell you that, right?
Oh,
Like
yes. Uh-huh.
I told somebody else, like I wish that they would come up with a different name for it because they're like, oh, it's just acute
Yes.
rejection. It's fixable. We'll get it back. But you hear rejection and you're like, oh my God. I remember when I had it, I was so upset. Like even though I knew the doctors, they always say it's common, it's fixable. I was like in tears. I was, crying to my
And
husband. I
they
was
did not,
scared.
yes, they did not prepare me at all for that.
They didn't.
I had no idea that could happen like a week after surgery. I had no idea.
That's common too, I've heard. Luckily, my doctors told me that it's a potential before I ever had the
Oh,
surgery. But a
yeah.
lot of people, they don't tell that to you. And then they're like,
No.
you're in acute rejection. And then you're sitting there terrified. And the doctors are just, whatever, it's fine. So
Mm-hmm.
it's frustrating.
Mm-hmm.
So that was good. So you finally get to go home. How long did it take before you got to go home?
13 days.
Oh, that's pretty good. It's pretty good.
Mm-hmm.
And so after you got home, um, how's it been? I know it's only been 6 months now, but how have you been doing since you got home?
Um, I think pretty fair. I had to get readmitted 2 weeks after I got discharged originally in January because I've had heart failure issues from the liver disease. So I had some heart failure and was retaining so much fluid from the steroids. So they admitted me, to get rid of some of the fluid, kind of jumpstart on it. It kind of worked, kind of didn't, but that's okay. And then February, I was a little bit down, I think, just from the whole winter months, not being outside. And then I couldn't be with anybody because of the infection risk. We had, RSV and everything going around here, flu. And
Yeah.
so they didn't want me really to be with anybody. And even if people came in my house, it had to be one person with a mask. And I was just paranoid about getting sick. So I kind of isolated, well, not kind of, I isolated myself. And so unfortunately, that I don't think helped my mental health at all between that and winter. But then in March, I unfortunately had renal failure and I had neutropenia with low white blood cell count. So I had to get admitted for 14 days again, and I had to sit in a room with a huge filter, and my door had to be closed all the time because of how severely bad my immune system was. And that didn't help my mental health either because then I sat by myself in a hospital room with the door closed
Yeah.
and you can only do so many puzzles and reading and stuff like that, and you just want to break out of the hospital. But I got over it, and then I was doing, I've been doing pretty good, I think, since then. I've had some other issues with other body parts and stuff, but it's mainly because of the liver failure and how bad it had to get last year that it's caused some damage, to my nerve system, to my brain, to a lot of other my heart and stuff like that. But we'll see. It's kind of a work in progress yet.
Yeah. Well, and I don't know if they've told you this either, but the first year after transplant is the hardest year because your body is getting used to its new organ, and it's like all these things can go wrong in the first year, and um it takes a minute before your new liver is like, okay, I understand. And so it's common for a lot of people to have a lot of different things happen during their first year of transplant. And for me, it took me so I had some setbacks in my first year, but it probably took me almost 2 years before I felt normal, before I felt like I could understand what my body's doing again. Because before my lung transplant, you know, if something was wrong with my body, I knew what it was. I would go and I would tell the doctors what it was and what to do. And it's a little bit different for you because you didn't have a lot of medical problems before. But I think for a lot of people that it just takes a little bit of time before your body understands what's going on, and then your mind and your liver work together and the rest of your body, and then it just kind of works itself out, you know?
Mm-hmm. Yeah.
Yeah. So, you're the youngest person I've talked to, not as far as age, but
Oh.
as far as transplant time. You've only had your
Mm-hmm.
transplant for 6 months. So I feel like you're going to have a lot more story to tell in the next year or two with the rest of your healing process. If you don't mind, I would like to ask, and you don't have to answer if it's okay, but you've mentioned a lot that you're younger. So I was just curious if you wanted to share your age with everybody so they know what you're talking about. And if you don't want to, that's
Oh,
okay.
sure. Yeah, no, I was 41 when I got diagnosed and 42 when I had the transplant.
Okay, that is young. Um, so yeah, so you still have a little bit of a hill to go to, but I mean, the good part is that you're out and you're home, and you're healing and you're doing great. And other than your broken arm there.
Well, yeah, my broken arm. Yeah, I was feeling physically a lot better. That definitely came before the mental part. I went to the Y and I was paranoid about germs, but I'm like, for me, I just need to get back into exercising a little, even if it's not a lot. And they said just gentle exercising. I just needed to do something.
Yeah,
So I was doing that well, right before I broke my arm, but
yeah.
because I still have, so I also got, I didn't add this in before because I forgot, but I also got terminated 2 weeks after my transplant from my job of 21 and a half years, out of nowhere, and left with no insurance after 8 days, other than I could apply for Cobra, but it was going to take months. And as everybody who probably is listening to this, or if they don't know, Transplant medications, especially right after transplant, are immense. And there's about 36 of them I think I was on. I think I'm on 33 right now. And they are very expensive. And so when you don't have insurance, and yeah, they say they're going to pay you back, but like 1 month of my medications was about 14 to $15,000. And at my age again, I don't have, $30,000 saved up just for medications and nothing else. Not to mention, I wasn't working before that and I wasn't making my regular salary. And now I went to get my brain tested because I don't know if I can ever work as a nurse practitioner again because my brain, like I had told you, had gotten kind of affected by some of these toxins. And now they've told me I can't even work as a nurse practitioner or a nurse. And they put me on a medication to try to help with some of my memory and cognition issues, which it's too early to tell, obviously. So we'll see. That's a work in progress still, but I'm remaining hopeful. But at the same time, I'm trying to figure out what to do with the rest of my life because that's
Yeah.
what I've done for 21 years. And it's kind of like I've never thought about doing anything else. I have a lot of hobbies, but my career was taking care of patients. And now I kind of have this, itch to get into the transplant journey with patients, maybe if that's something I can do. So I don't know, more to come potentially with that, but we'll see what I guess life throws you curveballs, and maybe that's a curveball that I was supposed to be thrown to get involved with, transplant journey stuff. So
Yeah.
we'll see.
So going back to your job that fired you, are they legally allowed to do that? I mean,
They
you were,
are.
um,
Yeah, apparently the Family Medical Leave Act only covers for, I think it's 8 weeks. And so they basically, and again, like I had told you earlier, I didn't even want to take off, even though I should have. They made me take off because of how sick I was. And by that time, obviously in January, I for sure needed to be off because I was in the hospital all the time. But um, apparently they can do that. I tried to like talk about like the Disability Act. I tried to talk about, one of my colleagues that is a male physician, who does the same job as me that got treated very differently through his journey of basically saying he was anxious and having anxiety, which I'm not saying that that's not something, bad or debilitating, but he got treated very differently than me. And, to me, they're both illnesses and they both should be treated equal. And he got treated a lot better than I did. And so we
mm,
talked about discrimination. I talked about all that kind of stuff. And basically, it was a 50-50 shot for a lawsuit. And I just didn't want to, put money into something I didn't know I could get. And I just didn't really want it to come back to haunt me because then you have to go through the whole trial thing. And I just kind of, at the
yeah.
time, I was having issues again with like some mental health, just depression stuff in February. And that was not making it better. And so I just felt like I needed to cut the cord and just be done. But I was still devastated and sad and hurt. And the way they did it and just cold called me in the middle of a Monday. I got discharged on a think Wednesday or Thursday, and I got called the next Monday, like literally 5 days after I got discharged. They called me and terminated me effective immediately, and I already had turned off my email and everything for work. Um, and I just couldn't believe that people would do that, especially a healthcare organization. When I poured my soul into their taking care of patients for 21 years, I thought there was something I could do there to help, their system, even though maybe I couldn't return to the same job. They
Yeah.
have 8,000 employees, and now they're actually merging with one of the biggest organizations in the state of Wisconsin. So I definitely, and one of them's a transplant center that I was listed at. So I could have had, something to do with patient care in those areas, but it was no discussion. They didn't want to hear it. They didn't want to talk about it. And they basically hung up the phone after they told me I was terminated. So I
Wow,
just
that's
decided
terrible.
it was time for me to just be done then because I needed to work on healing myself and that
Yeah.
wasn't helping. So
Yeah.
yeah, it was
Well,
very unfortunate.
wow. I'm sorry that that happened. That's terrible. That's terrible.
Yeah. Mm-hmm.
Well, I hope that something comes out of that or resolves with that or something better opens up for you because that's hard. That's hard to deal with when you're going through what you're going through right now. Yeah.
Absolutely. The timing was not a great timing. And I even if they would have talked to me about it last year when I was so sick, at least I could have told some friends or family to look out for what kind of insurances I could have had. Like I could have been better prepared. I was heard about the termination, but I understand there's policies, places, and if that was their policy, I have to be okay with that because that's a policy and I'm not in leadership, so that's fine.
Yeah.
But it was more about the way they did it. They could have come to me last year
Yeah.
and talk to me about that ahead of time. But to just, blindside you like that, it just, it just rubs you the wrong way. Like I said, especially when they're supposed to be community focused and taking care of patients, and they
Yeah.
talk about how they're great for the community. And it's like, but this is one of your own, like, irregardless of the fact that I worked there for 21 years, but I am part of the community. We're a small community, and we all know each other. Like, we have a great, solid community here. And like, that's the way you're going to treat one of your own. I couldn't believe it. Their
Yeah.
actions were just way different than their words, for sure.
Yeah. Well, maybe once you get, healed up and you get your brain situation evaluated, maybe it'll turn out where you can go back to that role and just find something, better, or another place, or something. I always think that things happen for a reason, and sometimes it's hard, and maybe something better is going to come out of it. You just got to
I know.
try to be positive.
I always told my mom, I told my mom and a friend the other day, I said, I don't think I would have ever left there. Like, I would have just been like, I could have been mad at times, but it's all of healthcare. Healthcare is not a good place to work right now. So, it's tough. And I don't think I would have ever left. So maybe it was a blessing. It was just the timing that had happened. Again, if it would have happened at a different timing, it would have been different. But the timing with the whole health insurance thing just added way too much extra stress on a time when I needed to focus on myself and healing. But
Yeah.
again, it's over with. So I just kind of let it go, because that's what you got to do.
Yeah. Okay. Well, I have one last question for you. And the question is, if you could give a piece of advice that you wish that you had before your transplant, what would that be?
I have two. The first one goes back to one of the first conversations we had, is you have to be an advocate for yourself and be a complainer, because I am not one of those people. And I had to do that multiple times.
Yeah.
I would say hundreds of times in the last year, because they don't listen, or they look at a lab and they think you're fine. Or like, again, where you and I are talking, you would think my brain is fine, and it's not, because other parts of my brain are bad. So just, you have to advocate for yourself. Like, just keep pushing, keep asking questions, keep telling them it's not okay, or you don't feel good, irregardless of what the labs or whatever show, there's something wrong, basically, so advocate for yourself. And my other thing was, to get through this, you have to find your village of people. I really had a village of people. There were people I expected to step up that I've helped in the past, and they have been nowhere to be found for the last year. And it's really disappointing. But then I have had so many people, I mean, CNAs in the hospital that I barely even knew in the hospital, that have sent me, checks. They've tried to give me, money. They've tried to prepare food for me. They've sent me cards in the mail. I mean, tons of neighbors that I don't even really know that have come and, dropped off, bars for my mom when she was staying with me. Just a village of people. And don't say no, you don't need it, because you do need it. And, I kind of put my life out there. I was a very private person. I started a Caring Bridge account with my friend, and I just put my life out there. And you'd be amazed how many people want to help and are there to help you when you really need it. And you think you don't, but you do. And you will if you don't right now, because I didn't think I needed it. And then 4 months in the hospital, I needed somebody to shovel my driveway, to mow my lawn, to pick produce in my garden. Like, it sounds dumb, but that's stuff that I needed done. And
Yeah.
I didn't have to say anything. It was just done for me. So I say, open your life up and let people learn from you. Because especially, again, being young, I want people to realize you can go from being the healthiest person ever to you're going to die in 6 months, like I did, out of nowhere, for no reason, for literally no reason. Like, it can happen to anybody. And so use your people, and people want to help. There's a lot of good people out there.
Yeah, I agree with that 100%. That's great advice. Okay, well, I appreciate you coming on and sharing your story. And I hope that I know that when somebody listens to your story, they're going to be inspired, and they're going to ask questions and be prepared. And I just wish the best for you. And you're still a baby, and you have a long ways to go. And good luck with that. And I want you to come back on the podcast in a year or so to give us an update on how you're doing.
Oh, absolutely. I'd love to. Yeah, okay. Of course. Of course.
Okay. All right. Well, you have a great day, and continue to heal and stay healthy.
Thank you. I appreciate it. Thank you so much. All right. Bye.
Thank you for listening to the Pre to Post Transplant Podcast. Please be sure to subscribe to the podcast and follow us on Facebook. Oh, and if you have not signed up to be an organ donor, please visit www www.organdonor.gov and register today. You too can save lives.